If you want to decrease the swelling and lymphedema in your face or your neck area, follow along with me in this video as I guide you through a complete lymphatic massage sequence to get that fluid out of there. Doing this lymphatic massage can help decrease your swelling and pain, and that can help improve your neck movement, swallowing, and speech. I'm Dr. Alex Hill, your physical therapist for everything oncology and lymphedema. I'm a certified lymphedema therapist and I specialize in cancer rehab. Let's get into it. Manual lymphatic drainage, or MLD, is used to help decrease the swelling from lymphedema. It moves the fluid out of the affected area back into the circulatory system. Before you start any new program, including MLD, make sure that you check with your medical provider first. While doing MLD, if you feel dizziness, shortness of breath, chest pain, something just doesn't feel right, stop immediately and let your medical provider know. If you have swelling and lymphedema in the face and the neck areas, it's usually best to do your MLD and do your massage first thing in the morning. Often swelling gets worse while you sleep if you're lying flat, so doing this massage in the morning will help to reduce that swelling. All right, let's get going with that lymphatic massage. Regardless of where you have swelling and lymphedema, the starting point is always the same: breathing and at the belly. You're going to start with your hands on your abdomen, right around your belly button. Breathe in through your nose, pause, and then slowly breathe out through your mouth. As you breathe out, you're going to gently press your hands into your abdomen. This helps stimulate the central part of the lymphatic system. But if you have pain or you're not comfortable with pressing on the abdomen, that's okay. Just simply do that deep belly and rib breathing to help move that lymphatic fluid. So go ahead and take a breath in through the nose, out through the mouth, and press in. One more time, breathe in and breathe out. Next, we're going to do that same breathing and pressure sequence, but we're going to do it at 4 different quadrants in the abdomen. We're going to start first at the right lower abdomen. Hands are right above the hip bone. You're going to breathe in, breathe out, and press in. Next, we're going to the right upper belly. Breathe in, breathe out, press in. Left upper belly, breathe in, breathe out, press in. Good, nice big breaths. Last place, left lower belly, breathe in and breathe out. Now that we've got the central part of the lymphatic system stimulated, we're also going to work on 3 primary groups of lymph nodes: in the armpits, behind your collarbone, and around your ears. First, we're going to stimulate the lymph nodes in our armpits. These lymph nodes here are going to be able to help drain and take up the fluid from the face and the neck and move it down. So with a flat hand, fingers together, you're going to place your hand right in the middle of your armpit, and you're going to do 5 to 8 circles. So this is 2, 3, 4, 5. Again, you can do 5 to 8 times. And then we're going to also do the other side. Fingers together. You want to make sure your hand is all the way into that armpit. We're going to do that 5 to 8 times. Next, we're going to massage the lymph nodes in our neck, right behind our collarbone. So you're going to take one hand, fingers together, make sure you have as much surface area as you can on your skin. And we're going to massage in a circular motion 5 to 8 times. You can do one side at a time like I'm doing, or you can do both at the same time. Okay? After 5 to 8 on one side, we're going to do 5 to 8 on the other side. So we're getting these lymph nodes ready to take up that fluid. After 5 to 8 times right behind the collarbone at the neck, then we're going to move up to the ear. So when you massage the ear, you have lymph nodes at the front and behind the ear. I like to separate my fingers. If you can do this and if that makes you think of Star Trek, that's awesome. But doing it this way allows you to really work on the front and the back of the ear with those lymph nodes. So if you have glasses, depending where the arm is, you can take them off so you have that full access. So you're going to separate your fingers and you're going to do 5 to 8 circles in front and behind the ear. And then after you do 5 to 8 on one side, we're going to separate the fingers on the other side. And we're going to do that same thing, massaging 5 to 8 times, stimulating those lymph nodes in front and behind the ear. All right, so now that we've got all 3 of those lymph node areas stimulated, now we can start to move that fluid. With the sequence, I'm just going to show you one side at a time. And so you want to imagine that your face, your neck, and your chest are split down the middle. So you're working on the right side or the left side. So I'm going to show you one side at a time first. And if you have swelling just on that one side, feel free to just do that half of the sequence. However, if you have swelling on both sides of your face, both sides of your neck, or in the middle here, which is where swelling likes to pocket at, make sure that you do the full sequence where we work on both sides. So starting at the midline of your chest, you're going to take your right hand with your fingers together and gently pump across from the midline of your chest to the left armpit. Now I'm showing this to you over my clothes, but best is going to be skin on skin. That's going to give you the best outcomes. So we're going to do that 5 to 8 times, starting to move that fluid again from the chest over to that armpit. And we're going to do that 5 to 8 times. Nice, slow, smooth movement. You don't need to give a lot of pressure with this. And again, making sure you're getting down into that armpit. Do one extra time here. All right, so after we work on the chest, we're gonna start and move up to the neck. Again, imagining that there's a middle line separating your right and left side. So on this left side, you're gonna take your right hand, fingers together, and you're going to massage down and out towards those lymph nodes on the side and towards that armpit. You're going to do that 5 to 8 times. At least. So if you do have extra swelling in your neck, if it's fibrotic, pause the video and spend extra time here. Take more than just that 5 to 8 times. That's just a minimum that's needed. If you have fibrosis in the neck, meaning you have firm, tight tissue, you can kind of massage it and knead it to get that to soften. But you always want to make sure that you then finish with that lighter massage moving out. Okay, so we're moving that fluid down and out 5 to 8 times. And you should have light pressure. You shouldn't be doing this super hard, making your neck red. And then after we finish the front of the neck, then we're gonna move to the side and the back of the neck. So you really wanna use your whole hand, close your fingers so that you get the most surface area. So you're going to come to the side and the back of your neck here, and you're going to massage that down. Your thumb and your index finger should be right at the back part of your ear. And so we're going to do that 5 to 8 times. Again, if you have extra swelling on the side of your neck, pause the video. You can do this more than that 5 to 8 times, but 5 to 8 is the minimum. We'll do that 2 more times. So we're moving it down and out, down and out, down and out. Good. Let's do that one more time. Again, at least 5 to 8 times. So after the neck, now we're gonna move up to the jawline. So taking your hand, again, fingers closed, as much hand and surface area as you can, you're going to massage and move that fluid down and out like this, okay? As you do it, you wanna make sure that you're using soft, slow movement, and that fluid really does move the direction that your hand directs it to. So if you're moving it up like that, it's not going to help drain it down, which is what our goal is. So you're going to sweep that. We're doing that 5 to 8 times at least. If you have extra swelling here, make sure that you pause the video, spend extra time. If you have swelling at your lips, then you can include it as you massage with your whole hand, like that. Or if you want to be a little bit more specific with it, then you can massage just with your fingers and move it out like that. But either way, you want to make sure that you're always moving that fluid out and down. After the lower part of the face, then we're gonna work on the middle part. So kind of the nose in between the mouth and the eyes, so right in the cheek area. And again, fingers closed, you're gonna massage that out to the side. Remember, we have those lymph nodes at the ear, moving that out and down. I tend to use my opposite hand for the other side of the face, but you can definitely use the same side. It's just whatever feels easier for you to do. So again, we're gonna do that 5 to 8 times. We'll do that 2 more times. Really get up at the nose. If you have swelling on your nose, spend extra time there. Okay, and you see my eye kind of move with it. That means that you're getting a good tension, but you don't want to be going too hard. Now, if you have swelling at the eye, take some extra time, use just 1 or 2 fingers, and you can move that fluid out. Again, you can do that 5 to 8 times. And then if you have swelling at your eyelid, you can also take 1 or 2 fingers and sweep that fluid out from the eyelid. Need a little bit extra time. Those are sensitive tissues and skin. It's very thin, so don't make sure that you're not using a lot of really deep pressure. After we finish with the eye and the middle part of the face, then we can work the forehead. So you can sweep again from midline over, you're sweeping that down and out. Again, 5 to 8 times. You can do same side or opposite side. You can switch it up if your arm's getting tired. After that 5 to 8 times, then we're gonna go all the way back down, but you don't need to do 5 to 8 times on the way down. We just need to do 2 to 3 times. So starting at the forehead, we've got 1, 2, we can do the eye, 1, 2, below the eye, 1, 2. We've got the cheek, moving it down and out, 1, 2. We can include the lips with that lower part of the face. So coming across. Can spend a little bit extra time at the jaw if you need it. And then we're coming the side and back of the neck. We've got 1, 2, 1, 2, and then the front of the neck, moving that all the way down. Really make sure you get right under your chin. You don't want to forget about that fluid. Moving that down. And then finally, moving it across the chest to that armpit. Okay. Excellent job. So again, that was 1/2 of the face and neck sequence. If you don't have swelling on the other side of the face and neck, then you are all set. However, if you have swelling on both sides, or if you have swelling in the middle here that kind of comes down, let's go ahead and start the second part of the sequence. We're moving across the chest first, Fingers together, hand flat. We're moving it from midline in your chest to that right armpit. We're gonna do that 5 to 8 times. And again, this just helps with moving that fluid and helping it drain even more. If these lymph nodes are kind of clogged up, then we can still use the lymph nodes in your armpit to help move that fluid. All right, excellent job. Let's go ahead and do 2 more times across the chest. You really want to be kind of between the chest and the collarbone here. You don't want to go too low or too high. So we're moving that across here. We'll do that 1 more time. And then from there, we start to work on the neck. So we're working on the front of the neck first. Most of my pressure is in through here, fingers together. You want as much surface area as you can. And you're moving that down and out towards the lymph nodes here and towards the armpit. So you're moving that down. We're doing that at least 5 to 8 times. And if you do have fibrosis or thickened tissue at the front of the neck that you did not address the first time around, then go ahead, do some gentle but kind of firm kneading in those areas that are a little bit tougher that you need to. Try to break up that fibrosis a little bit, and then always finish with doing that lighter massage down and out. So we'll do that 2 more times. A lot of people tend to have swelling here at the front of the neck, especially pockets right here, right under the jaw. So if you do need to spend more time there, just pause the video and spend more time there. So now we're gonna go to the back and the side of the neck. Full hand, fingers together. You're massaging that down and out. So you're massaging down. This is 2. Again, everything's at least 5 to 8 times, but if you need to spend extra time here, go ahead and pause the video. The pressure as you do the sweeping movement, this pumping movement, shouldn't be super deep. It should be pretty light. You shouldn't be done with this and your whole neck is red from massaging. It should be pretty light pressure. All right, let's do that 2 more times, really getting back behind the neck as far back as you can, really getting that whole side and back area. And we'll do that 1 more time, going all the way down and back. Again, we're always moving it towards the lymph nodes down and out. So now that we have the neck done, we're going to start working on the jaw. Again, we're working midline over, so we're doing the right side. You're going to take your hand, fingers together, and you're going to move that fluid down and out. So the direction is like this. This is for the lower half of the face. If you have swelling in the lip, remember you can work that in too. You're gonna massage that 5 to 8 times. We'll do that a couple more times. And again, you can spend extra time here if you have more swelling that likes to pocket here at the jawline. It's okay to do that. Just pause the video and spend extra time here. We'll do that 2 more times for the lower face. And then once we finish the lower face, we're gonna work on that middle part here, kind of between the mouth and the eyes. So again, we're gonna move that down and out. You wanna do it so that you feel that kind of skin stretch. You don't want it super light that there's no movement. You don't want it super duper deep. You wanna do that nice, gentle skin stretch with it. Again, we're doing that 5 to 8 times. If you wanna switch hands, you can do that too, whatever feels comfortable for you. So we're moving that down and out. Remember, we've got those lymph nodes at the ear that we just woke up at the beginning. They are ready to take up that fluid. Good. So let's do that 2 more times. Again, if you need to, spend extra time here. If you have swelling at the nose, spend extra time at the nose. Spend extra time wherever you need it. All right, and then if you have swelling at the eye, remember you can take 1 or 2 fingers and come just below the eye and move that down and out. You can do that 5 to 8 times. And then if you have swelling at the eyelid, then you can do that same thing, 1 or 2 fingers. And very lightly, you're just moving across that eyelid, getting that swelling out. And then finally, we get to our forehead. We're going to sweep that midline down and out. Remember, lymph nodes here. So we're going to do that 5 to 8 times. We've got 3, 4, 5. You can also use the other hand as well if that feels more comfortable. And then remember, once we get up to the top, we got to go back down. This time 2 to 3 times. So we're going to go ahead and do 1, 2 at the forehead. We're going to do 1, 2 at the eyelid, 1, 2 below the eye. We're going to go across our cheek, the middle part of our face. We've got 1, 2. We've got the lower part of the face and the jaw. We've got coming up this way. Again, 2 to 3 times. I tend to spend a little extra time at the lower part of the jaws because where that fluid tends to pocket. And then finally we get to the neck. So we've got the back and the side of the neck here. Moving that down and out. We'll do that 3 times here. And then last place for the neck, we're moving that fluid down and out from midline. Don't forget, right underneath your jaw. Okay. And last, we're going to be moving it across from midline in the chest all the way to that armpit. So don't forget, we got to do our breathing. Go ahead, put your hands on your belly, right around your belly button. Let's do 3 big breaths. So breathe in through your nose, out through the mouth, give some pressure. Big breath, really fill your ribs and your abdomen. Breathe out. And one more. Breathe in. And breathe out. Excellent job. I hope that this full routine for your face and neck manual lymphatic drainage massage was helpful and helps you feel better. Thanks for watching, and make sure that you subscribe to my channel and turn on the notifications so you don't miss anything else to help you manage your lymphedema.